Welcome. My name is Roger Blissett. I am Head of Government and Regulatory Affairs for the Americas for MUFG. As a longtime friend and supporter of the Foreign Policy Association, I am honored to serve as the moderator of this panel. Our panel today will discuss the social and economic recovery efforts in the wake of COVID-19. The panelists are Dr. Frank Snowden, Andrew Downey, Orrick Professor Emeritus of History and History of Medicine at Yale University. He teaches undergraduate and graduate courses in Italian history, European social and political history, and the history of medicine. Dr. Snowden's most recent book, Epidemics and Society, From the Black Death to the Present, published by Yale University Press in 2019, is the result of 40 years of research on the topic. Ms. Catherine Loubier was appointed Delegate General of Quebec in New York on February 6, 2019. Previously, she served as Deputy Chief of Staff to the Premier of Quebec, leading the transition team for Premier François de Gaulle, elected October 2018. Past roles include serving as Senior Advisor to Canada's 22nd Prime Minister, the Honorable Stephen Harper. Her mandate was to advise the Prime Minister of Canada on federal-provincial relations with Quebec. Finally, Dr. Costis Maglaras. Hopefully I didn't butcher your last name too much, Dean. I apologize. He is the Dean and the David and Lynn Selfin Professor of Business at Columbia University. He's a member of the Executive Committee of Columbia University's Data Science Institute. His research lies on the interface of stochastic modeling and data science, with emphasis on stochastic networks, financial engineering, and quantitative pricing and revenue management. After opening remarks by each panelist, the three topic areas that will guide our discussion will be lessons learned from COVID-19 in the short, intermediate, and longer term. How will the disparate impact of COVID-19 on communities of color and on other vulnerable members of society, particularly senior citizens, along with the recent protests impact public health, education, and economic policy going forward? And lastly, what, if any, impact do you foresee that COVID-19 will have on demographics trending toward urban centers? So with that, I would like to ask Dr. Snowden to give us his preliminary remarks.
Well, thank you very much. I'm delighted to be with you. I would like to begin, I think, by saying how I see COVID-19 as a disease, and I would define it as the first great pandemic of the era of globalization. By that, I mean by globalization that we're a planet now with nearly 8 billion people, a massive demographic increase, that we've had vast economic expansion, and that has entailed deforestation and the invasion of animal habitat, which leads to increasing contact with animal species that we've never, as human beings, had contact with before, and that leads to the spillover of new and particularly viral diseases. We also are a planet with many, many congested cities and mega cities, and all are linked by rapid air transport, in which, well, at least until January, millions of people through commerce, business, cultural exchange, tourism, and so forth, were in constant movement around the globe, so that a microbe that emerges, let us say, in Kinshasa in the morning will be in Los Angeles and Paris by the evening. Well, COVID-19 wasn't the first pandemic of the era of globalization. We've had SARS, MERS, Marburg fever, MIPA, but it's now COVID-19 is the first that's really readily transmissible and adapted to the world we've created. It travels, it seems, on paths that we have created of poverty, ethnicity, and vulnerability. I would think that this disease is very likely to be transformative, and that is because it doesn't move rapidly through populations in the way that, say, the Spanish influenza, which left a surprisingly small impact despite its great mortality, COVID-19 seems to lay siege to communities for a prolonged period, and it also seems that it's not going anywhere, but is very likely to be with us for at least the medium term. And so one expects that there will also be, for some time, not a vaccine or a reliable treatment. So I believe that this is presenting us with a great challenge. How do we coexist with COVID-19? But that's not all bad news, because if we succeed in devising appropriate measures, it means we'll be prepared not only for COVID-19, but for the next pandemic challenge that is likely to emerge. And virologists and scientists tell us that such events in our future are more or less inevitable. And it also means an opportunity to address societal inequities that promoted this disease in the first place. So I would like to frame my understanding of COVID-19 in those terms.
Thank you, Professor. If Ms. Loubier, if you could join us with your remarks.
Yes, thank you, Roger, and thank you, Professor Snowden. Very interesting and a thoughtful introduction. Well, it's great to give the Canadian Quebec perspective. Thank you for inviting me and in my role as representative in the U.S. for the Quebec government. It's been 80 years that we have an office at Rockefeller Center this year, and it's almost as long that we've been collaborating with the Foreign Policy Association. So I do want to thank Noel for his continued support. So Quebec shares a border with New York, Vermont, and Maine. And so what happens in the US also happens in Quebec. I'd like to give a bit of context for what happened in Quebec in terms of the COVID crisis, and then focus on the economic impact and how we prepared for a recovery as a government. So Quebec is the most impacted province in Canada. There's many reasons to that, but just to give you the basic data, we have just close to 55,000 cases of COVID-19 in Quebec, including about 5,500 deceased. And the number of deceased in Canada is 8,300. And so we are the most impacted province, and the city of Montreal, we're talking urban centers, has been the most impacted. In terms of the vulnerable population, 91% of deceased were 70 years old and older, and close to 97% were 60 years old and older. And so that's really how we were at the same time able to, because of this concentration, reopen quickly in phase and in a meaningful way, put the economy back on rail. Just to take a step back, the government had presented a balanced budget in March of this year. Seems very far away already, with an unemployment rate at 4.5%. Now, the situation we're in, as a lot of economies around us, was a sudden interruption of 40% of our economy for 8 weeks, leading to about 28 billion in intervention in our economy, and unemployment rate now at 13.7%. Mind you, in April, it was about 17%. And deficit was a deficit zero, and now we are at 14.9 billion in terms of deficit. So what is the game plan ahead? These major crises are opportunities for change as well. And so we've looked, I was charged by my government to look at all we have 33 offices in the world, to look at what's on the drawing board of other governments in terms of recovery. What are they looking at? What kind of measures are they going to put together? And also we looked at major crisis and pandemic in the history of this world, and what happened, what were the big lessons the innovations that came out of it. How did they manage change and overcame these crises? And this thorough report and intelligence was sent back to our government in Quebec City to be able to make decisions on recovery. And just to name a few, we've found that some sectors of the economy are completely stopped by the COVID crisis, such as tourism, but other sectors are stimulated by the crisis. And so we decided to focus on these. We knew that the crisis would bring protectionist currents. And so we decided right away to organize to demonstrate to our American friends, where we export 70% of everything we build, that these quick measures of protectionism would self-inflict damages on the US economy as much as the Canadian economy. And so we were extremely active on that front. And we believe that diversifying our economy will be key because we have very strong sectors that can rebound from the crisis. And just in closing, we've also engaged with a number of American boards of trades and associations to join American voices to our voices and unite in a message of free trade. We have over 100 signees from all over the US advising the state and the federal government that protectionism is not the answer and can backfire. And so, I think that the big lessons are, as you were saying, Professor Snowden, if this is going to happen again, we need to stockpile, we need to prepare, and we need to not take anything for granted in our relationship with the US to prepare for the next, we don't hope so, but the next pandemic or wave of this pandemic. Thank you.
Thank you, Catherine. Dean, if you could give us your opening remarks.
Yes, thank you for inviting me in this panel, Roger. So I would like to say a couple of things about what happened in the university system and my viewpoint from essentially operating a school in a large university in a very urban environment. So as you all know, that universities work on a model that involve density. We bring people together and we bring people together to vigorously debate, discuss issues. And that model was obviously challenged through COVID-19. So what happened is we very quickly moved to de-densify our campuses, our laboratories, classrooms, and we switched into a virtual operating model, almost. I would say the other thing that we did, and Professor Snowden is at Yale. Yale also, like Columbia, has a big medical arm to it. So a portion of the university switched to being fully committed to actually dealing with the COVID-19 crisis. And our medical facility was one of the instrumental pillars of dealing with that in the city of New York. New York Presbyterian, which is Cornell and Columbia together in the city, deal with about 30% of what's happening in Manhattan. So that's quite a bit of activity, if you wish. So now this process was rapid, abrupt, I would say in some ways successful. We learned quite a bit. I'll identify a couple of things, but one would hope that we'll discuss that more in the next hour or so. And I think it highlighted the value of universities. And in some sense, we're looking at universities for this sort of deep scholarship, deep science to actually help solve that problem. As opposed to being sort of detached from what is happening, we actually look at these institutions for both their help in the medical treatment, but also for now, how can we invent solutions, cures or drug therapies for the crisis. So I think it has highlighted also the value of these institutions have placed so much high emphasis on deep scholarship, which has been, I think, a bright spot. And this has been also the portion of universities that have continued to operate in person at 100% capacity throughout that period. So, you know, like suddenly all of our labs that could work on that started working sort of pretty much tirelessly in these issues. Now, what have we learned? So we learned a lot about our healthcare system. We also learned quite a bit about our healthcare system in this country versus healthcare delivery systems in other countries. So that's a very interesting research study that we can do about both preparedness, but also delivery of how do we administer care. The second thing that we learned, which is closer to, let's say, what I do now as a dean of a business school, is we learned quite a bit about global supply chains. Frank mentioned globalization and this connectedness across the world. And the economic driver of globalization is this global supply chains. How, in order to produce a product, we may have to collaborate across geographic boundaries in ways that connect us, and as a result, can be a mechanism for spreading an epidemic like the one that we actually experience right now. We also learned quite a bit about how we work. We're now 5 individuals in a conversation. We're not physically in person. We're in 5 completely distinct locations. We could have been in different countries. And that is by no means counterproductive to what is happening right now. And I believe these lessons are going to be things that are going to stick with us in the future. I want to finish my comments by mentioning one more thing that, you know, Roger, you mentioned earlier on about the vulnerable populations and populations that were disproportionately affected by the pandemic. I also want to recognize that we're facing essentially right now a double crisis. And in the last 4 weeks, we have brought into the spotlight issues of racial discrimination, injustice, that may be connected or are connected with how COVID-19 has disproportionately affected a portion of our population, at least in this country. And that's, we need to be thinking about both of these problems in a very proactive way, in a way that will actually we can make positive change, positive influence in the future. And clearly universities have a role to play in that, and maybe we'll touch upon that later on. So I'll stop at that.
Dean, thank you for your remarks. Since you have the mic, we're going to stick with you for a moment. I know that while my children are beyond college age, I have a daughter who's in medical school. So I think there's a lot of interest in how you, as an executive at a higher institution of higher learning, are approaching what's going to happen in the 2021 school year. From 2 perspectives. One is the folks who are matriculating and have to finish their course of work, but also for those students who are thinking of pursuing a graduate degree and with a terrestrial kind of an in-person approach, not an online approach. How are you guys looking at the fall semester in terms of, you know, how are you going to be offering classes? Is it going to be a fully sort of in-person experience, or is it going to be a mix of what you've learned in terms of online and in person? Okay,
you're asking a difficult question with a lot of privileged information, and I don't want to front run our president by saying what we're going to do. But let me I'm part of a small committee of 6 people that are working with the provost and a few other deans on how we're going to restart the instructional piece of the university in the next academic year. So I'm intimately connected to this question. So I think every university, not just ours, is going to make every effort possible to within what's safe to actually bring back students, bring students in classrooms, bring students to interact between themselves, but to also interact with faculty, and start to rebuilding the type of experience that one expects when you come to an academic institution like ours. I believe that public health guidance in the fall semester will be one that will constrain the extent to which we will be able to do that in the way we used to have done it even 12 months ago. The same way I expect that the same public health considerations will prevent Catherine, from going to Rockefeller Center at the same level of density that she has done in years past, or all the way up to early March. So we will need to operate with similar type of considerations, and so that may mean that small classes will happen in person, but bigger classes may happen in a different way. Or it could be that there is this lingo that people call high flex. We may bring a portion of the students in person, and then the rest of the people are actually virtually connected to the classroom. The classrooms will be technologically retrofitted so that this looks like we're all here. And then maybe the portion that is in the classroom can rotate. So today it's you, tomorrow it's me, Catherine is on Friday, and what have you. So our effort is to try to bring back, to the extent possible, an in-person interaction in the university. But I think we need to be clear-eyed and understand that it will not look the same as it did last September. The same way working in Manhattan in New York is not going to look the same as it did last year, or London or Paris, or so in some ways, large urban cities will have to grapple with that over some period of time, and we're preparing for this as best we can. But the goal is to try to bring students back, maybe not all of them. There's a consideration if you can only bring half of your students, for example, not just in our program, but in other universities, you can see what they write. Who are the ones that should come? And question of privilege comes again, and economic standing also comes into play, because some people may be able to actually attend pretty fluidly from their homes, and some others cannot, for example. So these are some of the things that we're considering. We're considering how we're going to be able to create a safe environment for dormitories. I would say the undergraduate problem, it's much harder than the graduate education problem, because in the graduate education problem, people live in apartments. It's easier to control that interaction than putting people in a crowded dorm. So that's we will, I think in the fall, in our school, in our university, and in other universities, we'll see sort of a heterogeneous type of solutions where different schools actually are allowed to do slightly different things, and it will depend on some of these characteristics. Do you have a dorm? Do you have? Do you teach large classes versus small classes? Do you? Are you a commuting school, let's say, in a rural area in some other place, or are you an urban campus like ours at Columbia? So, we're trying to, and if I were to sum it up in one sentence, we're going to try to have as much in-person interaction as safe.
Thank you, Dean. Ms. Loubier, Catherine, on a larger scale than the college university campus, what have you seen as lessons learned as you've thought about and you've counseled the province in terms of reopening, and what kind of considerations have you guys been factoring in terms of various phases that you've put in place with regards to reopening?
Right. So in terms of reopening in the province, I think that Quebecers are pretty good at listening to the guidelines, the health guidelines. In fact, there was a comparison done, I think, by Google of 130 something countries, and Quebec was ranked one of the first ones. And I think that what I've observed too is the leadership of the Premier or the leadership of Governor Cuomo in New York, for example, in rallying the population into adopting those health measures, guided by the health, the head of the health department, whatever you call that in each of your jurisdiction, made an enormous difference into adopting those practices and flattening the curve, if you may. So this was very effective in Quebec. In terms of reopening or re-engaging, the communication was key. Communication by those ministers responsible for announcing the different phase of reopening, what the rules were, how people should behave, wearing masks, distanciation. Same thing with the guidelines in manufacturers and on the workplace, in the retail system. They're as good as they're credible, and I can say that the objective was attained in Quebec. In terms of reopening our work, so our business is to engage with U.S. companies, businessmen, elected representative to promote our interest and to defend our interest. We have switched as fast as we could have ever thought that we could to working remotely, to working like we are doing right now, and that has come as a challenge at first. But it's amazing how humans are resilient and adopt the technology that was there all along, available to them, either for work or education. I think it's the same thing. And so we've started doing trading again, having those B2B meetings, having those thought leadership webinars, and finding a way to get back on track in terms of serving the client, which is our main responsibility. So that was impressive, and we got also some of the technological tools to our employees to make sure this was possible. I guess two things were unveiled while doing that. The first one is how important building a network is, and being able to pick up the phone and call a U.S. representative or a business. The second thing, as I said earlier, is we can't take anything for granted. When 70% of what you export comes to the U.S., if you take that for granted, that's when you're going to start to have some problems. So the strength of the network that we've built over 80 years now, being present in New York, and we have 8 offices in the U.S., was something that we rediscovered. And in the challenges, it brings us together. I'll give you an example. In 2019, Canada sold for over $5 billion in COVID-related medical products to the U.S. Canada remains the first destination for exports for the U.S. The U.S. sells more to Canada than any other countries in the world. And 25% of those medical products that we sold to the U.S., COVID-related, come from Quebec. That's something we didn't know, that we were able to, you were saying, it takes stock of the supply chains and realize, wow, we're very dependent on each other, and we build things together, and we make things together, and we can recover together as well. So the power of the network and how this crisis has brought us closer together. There remain some challenges. We were talking about Rockefeller Center. I think, very, very soon I will have a group of employees that will go back physically to the office. But as the dean was saying, we'll have to do this in phase. We'll have to limit the number of people. We'll have to have reinsertion policies. We all need to invent that. And so again, we're talking to our colleagues in our 33 offices in the world and in Quebec City, our government city, and we're putting together these protocols to be able to get back to normal. It's very difficult too to plan the budget, to plan our objectives, to rally and motivate employees around clear objectives for the rest of the year, because we don't know what it's going to be made of. We have an idea. We think that in 2021 there might be some coming back to normal, but as the professor said, there might not be. So adaptability, agility is really key for us in this crisis, and trusting the head of your health department into making the right choices to balance wanting to get back in activity with health concerns. And I think I will end on that, same as the Dean. This balance is extremely important, and there's no recipe. We haven't done that before, and so we need to reassess constantly and adjust to what occurs around us. And again, because we share a border with the US, everything that happens in the US, we always say, if you catch a cold, we catch one too. That's very true. I need to add that the closing, or the technical closing of the border, for me is something I take extremely seriously. This is unprecedented. This is the largest, safest, most productive region, economic region in the world, and the longest border in the world. And so in a way, it saddens me to see the border technically closed. It remains open to goods going back and forth, but this is we can't normalize the closure of the border. And in the same way, you know, we need to be with each other. We need to visit each other. We have thousands of medical personnel that go and work in the North Country, for example. We had to resolve that. We couldn't close the border to them because hospitals in New York, North New York, would be lacking personnel. And so as we went, we resolved each and every issue in an open-minded way, balancing again the need for continuance with the need to stay safe with our populations.
Thank you. Professor Snowden, Frank, as you listen to the challenges that the Dean and Ms. Loubier, Catherine, have discussed in terms of how they're approaching opening in advance of any sort of success with regards to a vaccine, based on your study of pandemics, how would you advise policymakers, executives on college campuses in terms of how they should approach this balance between reopening and mitigating the risks associated with the current virus versus, a strict shelter in place that over time, is going to be difficult to maintain, and as we're seeing that, various folks are struggling with. Do you have any advice in terms of what you're seeing that works short of a vaccine being available, and what folks should maybe rethink or think a little bit more carefully about?
Well, certainly, yes. I think that a first point that needs to be stressed is that it really is not a useful dichotomy to think of going back to normal on the one hand, whatever normal used to be, and on the other, being in full lockdown mode. We need to learn to coexist with this virus in a middle ground where we practice sound health while allowing our economy to move again. And we need both of those things to happen, and they need to happen simultaneously. But what is very important, it seems to me, is a first thing has to do with, I know Catherine was stressing communications, or we might say messaging. And contrasting different countries, I would say that one of the features is that if you look at many countries in the European Union, they had really clear messaging from one voice about exactly what was necessary, that was explained in a scientific and careful way to the population, and there was enormous compliance. I witnessed, for example, what happened in Italy, where I was for 6 months of the pandemic, and there was extraordinary compliance. In fact, the local newspaper of Rome said this is the first time in 3,000 years of Rome's history that Italians have ever been obedient. And I think there wasn't a movement of rejecting the lockdown, even though it was more severe than in the United States and lasted longer. And reopening is now occurring in Italy and other countries of the European Union. And it's happening, though, under guidance from public health. So that first there is the mitigation of the disease, and then after that, large-scale testing and certain sectors opening first, watching how this great experiment is proceeding, and then making certain that the environment is not what it was that got us into this in the first place, but cities are beginning to redefine and reimagine how they should be structured so that work is staggered. Many work at home, that people will be enticed to have to commute, not to do so on crowded buses and subways, but rather many more people commuting by bicycle. That pavements in the city of Milan are being vastly expanded so that people can practice social distancing as they go shopping. And so this also has a knock-on effect to entertainment, cultural activities, restaurants. All of those will have to reimagine how they conduct their activities. It's not a full closure. It's a reimagining of a possible existence with a dangerous microbe that we have to be careful with. And I would echo a lot of what Costis was saying from my own university, Yale University, which is talking about a combined, it says it's going to be residential/remote, which is to say that students will have the option, if they wish, and their parents wish, to stay at home and take their classes remotely. And that should reduce the density of the undergraduate population. And then major classes, big classes, may also be conducted remotely, but small seminars could be done in spaces so that students still have safety, but also what I think is very important, and Costis was also discussing this, the relationship with the professor and with each other is another major factor that's part of the success of American higher education. So I think the main thing I would stress then is not this dichotomy, but rather not going forward in the sense going back to what we were before, as we see in a number of states in the United States, but rather going forward in a well-planned, structured way that enables people to coexist safely with the virus. So I would talk about the need for planning, for careful public health, for careful education and communication with the public by a single voice that presents a truthful, clear message and gives people weapons, that is to say, means by which they can protect themselves, their nation, their communities, and their families. And we have those tools to do that. And so I think that's the spirit in which we need to move forward.
Sorry, just a quick observation. Prior to COVID, I noticed that younger professionals were having more difficulty with personal relationships, conversations in person. They more and more have been reverting to texting or IMing. You know, I don't know whether as professors you're seeing that in the academic context. I know in the workplace, Catherine, I noticed it a lot. I'd see on a trading floor folks communicating who are sitting back to back via an IM system as opposed to turning around. And I worry in this remote environment where we're leaning more on these tools, if we're socially retarding the next generation of professionals or citizens in terms of not being able to, you know, conduct conversations in person. I mean, my wife and I would go out to restaurants and we'd see younger couples texting each other or texting in the midst of a dinner. You know, I just wonder, as we think about the intermediate step of balancing, as you said, Professor Snowden, Frank, you know, are we on a tipping point where we're maybe promoting less interpersonal tactical relationships and a reversion to more remote platforms to communicate? I just wonder, both in the work context, Catherine, as well as in the academic context, if you
Yes, well, I would address the academic context, and it seems to me that there is a danger. Technology always is double-edged as a sword. We've learned that through the Frankenstein story. But clearly, I don't think it has to be a negative. It's a matter of learning to use the technology in ways that are productive, and also not to rely exclusively on the technology. It will be important for the students to have face-to-face contact with each other, with members of the teaching profession. That's part of the educational experience. But it's also possible to use the technology in creative ways and to make certain that everyone is educated into what and how to do that, so that people are creative in their use of the technology, so that classroom discussions can still continue. I think that this is the great challenge, but I'm very confident that with goodwill and with lots of time invested in discovering and course correction as we go forward, we're discovering what works and what doesn't work. And doing that, I feel very confident we'll be able to find a system that will actually work for our students and our communities and maintain the educational excellence that's essential to our future as human beings and to our economy.
Dean, I wonder if you could maybe add your thoughts.
Yes, yes. So I agree with pretty much everything that Frank has been saying, and I certainly agree that the way we should be thinking about how we're going to operate in the medium term, short to medium term, is not on the boundaries of nothing or everything, but we need to find how we operate in this continuum so that we can have a viable path. But in terms of this virtual mode of existence, I actually think that, yeah, so if we were to rely on the technologies that we have right now and continue to do that for a very sustained period of time, that's not very good. I mean, you know, it just it sort of severes personal interaction, personal conversations, in ways that, as the way you and I probably reflect on life, would seem counterproductive. I do think, however, that, and the same thing applies for remote work, right? We have all said how successfully we switched to remote work. And I agree with that statement. I do think, though, however, if we kept doing it for the next 36 months, we may find that, you know, we're starting to sort of, some people start to be a little bit untethered, so to speak. So we will need to find ways to, both for social interaction, but even for remote work, and some of this can may be technological ways, and I'll give you an example in a second, that will facilitate the serendipitous type of interaction that would normally happen when you're walking in your in the hallway on your trading floor, or when you're exiting the classroom at our university. The instructional piece is let's say the easiest one to address, but this little conversation that the two students or the three students may have when they're walking out of a classroom, that's harder to replace. But here is something that people have done. We're even looking at it. There are virtual reality solutions where I could, when I leave my classroom, say that I'm just going to go and hang out in the library. And I'll put myself in the library and work there. And when you exit the classroom, you may intentionally say, what I'm going to do over the next 10 minutes is walk through the library. And then when you're walking through the library, you're going to get a signal that says, Costis is sitting right there. And then you may actually stop right next to me, and then suddenly a window will pop up, and you'll say, hey, Costis, how are you doing? Well, Roger, what's going on? And then we'll have an impromptu conversation, almost facilitated through technology. Now, I don't want us to go straight down that path, okay? This is not where we need to be operating as society for a very, very long time. But if we're gonna have 10, 20, 30, 40% of our workforce or more working remotely over the next 12, 24 months, and then maybe that will stick around for some time, we need to allow for these water cooler conversations to actually spontaneously happen. It cannot all be scheduled Zoom calls or texting. Okay.
Absolutely.
So we need to find a way to replace that spontaneous interaction. The interaction that is both productive and also the interaction that is just fun and decongesting, because other people are getting stressed out by this mode of existence as well. We haven't brought that up, but this idea of being cooped up in your house, working remotely, having this very structured type of interactions, not everyone thrives in that, humans are social animals, and they actually like to be around other humans. So we need to be able to address that. And I agree that that's long term. We need to find a solution, and we need to find a solution even for the next 24 months.
Thank you, Dean. Catherine, any thoughts in terms of how that's impacting the broader opening conversation you're having, in the province, as well as your mandate in terms of trade and business?
Yes, I mean, we are social animals. Costis, you said it. I think, if I look at the political world, the premier is holding meetings. He doesn't have a choice. So it's funny because you see the meetings went from a small meeting room to a giant meeting room with 2 meters between everyone. I mean, it does pretty funny photo ops, but this is what's happening. I mean, they're doing these meetings in giant rooms and being spaced out, and it's still working. If you look on the side of the U.S., you've got a presidential election going on. I mean, the bread and butter of a politician is to meet people and rally and raise money and engage. And so you see the pressures right now of holding elections by the Postal Service. You see those conventions announcing dates and locations and rallies. And it's very hard to predict who will show up and how they will show up if it's not well organized. And I think there's kind of 2 schools of thought here. There's those who are back to work and just, have processed the risk, the health risk, and are just, have put it aside and have decided to live with the risk and learn to live with this microbe that Professor Snowden was referring to. and those who are extremely cautious. So I think there'll be two models as well for doing business. But the sure thing is we need to see each other. We're social animals. So, you know, New York City, if you go to cocktail hour, you can have 4 new clients when you get out of a half an hour beer. So, I mean, this is what scares me in terms of, for example, Manhattan and other urban centers where you would be drawn there because you could do business and everybody would be there to do business. And so it's not ideal long-term to be in those webinars all day and to try to do business and to fake it till you make it, literally, in terms of you know, having those people-to-people connections. So I agree, it's not, I think there's part of the activity that will have to be face-to-face, even if we act like giants. And part of the activity will be online. You know, the finance world doesn't really need to be in the same room to do business. But, you know, the salesperson and the entrepreneur who needs to show a product, right, to a buyer on the other side of the border, this is extremely damaging for these people. You know, 1 in 4 business, 1 on 10 jobs in the US is retail. More than 50% of retail businesses have closed down forever. We've passed the 90-day from the crisis, the beginning of the crisis. Well, after 90 days, they have to close their doors. They don't have any more plan Bs. And so I think this will take an extreme toll on some of the businesses and create a lot of poverty. We have to realize that, you know, this will create a disparity in between sectors that have almost not felt the crisis and those who have, such as hospitality and tourism, for example. So there are some dire consequences to these electronic-only way of doing business. And we need to be prudent, but I think some of it will come back. It has to come back. We have to be prepared for other pandemics or what we call waves, maybe, set back electronically and then push for human contacts when we can. But at the end of the day, I trust that humans are really resilient and will find ways to trade because it's part of our DNA also. So.
Thanks for that. You mentioned 2 things that I want us to try to focus on in the time we have remaining. One was how this impacts urban centers in the intermediate and in the long term. And then the other thing you said, Catherine, I thought that was that Dean Maglaras talked about earlier was the impact on inequality, disparate impacts on communities of color or seniors. Let's talk about, you know, how we can mitigate some of these trends in the short term and in the longer term. As we mentioned earlier, we've seen this eruption of protests around the disproportionate use of force by policing departments on communities of color. We've seen the numbers when it comes to disproportionate impact of COVID on the same communities and on our elder citizens. As we think about how to move forward, you know, what role does scholarship play? What role do the universities play? What role do public policymakers like you, Catherine, play as we try to tackle those things moving forward? So why don't I start with you, Catherine, and then we can move to the other panelists.
Mm-hmm. So in terms of urban centers, I think, you know, maybe my panelist colleagues will have more to say, but what our observation is we need to have new ways to be in a big city. I mean, if you look at New York City, it's almost 8.5 million population. It's the same population as Quebec, except you can fit 1,217 New York City in Quebec. So, I mean, New York City is unique in that sense. And I think that I don't know that we will see the Manhattan we used to see, and unless we open up streets, as the professor was saying. So I think, you know, for Quebec, Montreal is looking at new ways of reinvesting the city. in an orderly way, in a way that will keep us safe. The spirit of New York City, I don't know if it will come back as it was. I think it's learning to live with the new reality. In terms of vulnerable population, well, as I said, and overwhelmingly, it impacted the elderly in Quebec. There's a big effort now to, and it was previous to the pandemic, in fact, reinvest in elderly facilities to make it more livable, to bring back dignity and care in those facilities. And now this will be added to the plan of the Premier in this big rehaul of elderly facilities, because the population in Quebec is aging, the demographics are there. In terms of what happened following George Floyd incident or killing, the Quebecers took the street, as everywhere in the world. They took the street. And the Premier was very clear and fast in saying a majority of Quebecers are not racist, but racism exists. And it cannot be tolerated. It cannot be tolerated. And so he has asked a number of his ministers to form an action group, not a committee. He's a bit allergic to committees. So an action group with real action to change things. And so two of our ministers who happen to be of Asian descent, as well as our Aboriginal Affairs Minister, have formed a group. There's also an ex-policeman that is an elected representative sitting on the group, and they must give action orientation this autumn, so that we do our share and we change things literally. And so this was done with no delay. And I hope that we will see strong policies emerge of that, strong action. And I hope that the Quebec population and the Canadian population will not forget what happened, and that racial discrimination is absolutely unacceptable and cannot be tolerated. So this is how he responded to this in Quebec.
Thank you. Frank, do you have any observations in terms of lessons learned and what we should be mindful of as we move forward and to try to achieve more equity and less disparate impacts of the virus or the protests that we're seeing?
Absolutely. I think that we can go back to something that the great African-American thinker W.E.B. Du Bois said, which was in 1898, that there were extraordinary health disparities that afflicted the African-American community. And he said what surprised him was not that the disparities existed, but that a civilized country would tolerate them. I believe similarly, we have seen that there were studies of, let us say, the Hong Kong flu in 1968. And it was disproportionately affected African Americans, and epidemiological studies were done and have been done since. So epidemiologists confronted with the idea of a virus transmitted through the air, the way COVID-19 is, would have been able to predict the way that the virus has spread in our communities, and the disproportionate affliction of African Americans is the result of structural factors. And one of those is access to healthcare. And African Americans had disproportionate, this is true of Hispanic Americans and Native Americans as well, had disproportionate pre-existing conditions. And those result from not having access to care. And therefore, I think one of the things that has to happen, we have to reconfigure our healthcare and its delivery so that everyone in our nation, and the United Nations calls for everyone on the planet, has access to care, because we're all in this together as a global world. I think we also would know that there are hotspots where African Americans and Hispanic Americans are overrepresented. And this relates also to the demonstrations, and that is our system of incarceration. prisons like Rikers Island were petri dishes for the explosion of this kind of catastrophe. And we have to rethink our criminal justice system. Housing was a major factor. If you live in a teeming tenement, and in that the rent is high, you can't possibly practice social distancing. And so many, in fact, African-American families find that their water is cut off. What kind of message is that for washing your hands as often as you possibly can? And then families that are impoverished are driven to double up. Already overcrowded, they're now doubling up more than one family and an occupancy that was designed for one family. I think we need to think long and hard about our criminal justice system, about our healthcare system, about housing in our country, also homelessness. The homeless are disproportionately affected, and they're disproportionately minority people. The Native Americans are per capita the most homeless people in America by a factor of about 100. And African Americans and Hispanics are also overrepresented. And so the whole problem of homelessness needs to be tackled. So what I'm trying to say is that these are not chance. We have created as a society the paths by which this disease is spreading in our midst. They have been created by human beings, and those paths can be closed by human beings. And a different, more equitable, and what we need to think about now, more healthy world can emerge on the other side of this. And so I think the disparities and the inequities that have been revealed also have to do with our vulnerabilities as a country and a world to these kinds of afflictions. And therefore, tackling them serves a double purpose of it's humane, but it's also prudent, because this is our survival mechanism as a society to deal with those hotspots in which these diseases find us all too vulnerable and all too easy to thrive and to spread. So that's kind of the message I think I would take to dealing with the disparities. Change is necessary, and people on the street are saying it, and there are reasons for that, that they're disproportionately at risk in all of these ways that we now know.
Thank you. Thank you. Dean Costis, I wonder if you can bring us home with your remarks here. You know, you mentioned something when we were preparing for the panel that, you know, as an administrator at a college and university campus, you know, you speculate as to what would have happened if your contingent, your cohort was still on campus in this environment. But the flip side is, I wonder if they were on campus, whether the agents of promoting the protests would not have been unleashed. I mean, I think a lot of young people may have been behind some of these protests in different communities across the country. Anyway, you know, taking that into account, I wonder what your views are on the two issues. One is the disproportionate effect of the pandemic on vulnerable communities, including communities of color and the aged or seniors, as well as what we should be thinking about in terms of promoting a fairer society as we think about how we move forward.
Good. I'll take that maybe in reverse order, and I'll start. Earlier on, you asked, what do we think about this, the future of urban centers like New York? I'm super confident in New York that it will bounce back and it will be a most thriving capital as it is. But I think we're learning some things. Urban transportation was a vector that infected many, and it infected different populations heterogeneously, simply because different populations use, let's say, the subway system in a heterogeneous way. So urban transportation is something that we're going to learn and we're going to have to work on. Future of work will actually affect the extent to which cities will decongest or not. You know, how effectively can we work if, you know, a fraction of the workforce is working remotely, and what does that mean? Do you never come in? Do you come in once a week? So that's, I think, real estate may be affected by that, and by that, it could be that we may have a shift from commercial to residential real estate. Now we need more space at home. This is not going to be the first time. There are big buildings in New York City right now that used to be department stores about a century ago, and now they're condo buildings, or they're co-working spaces. So real estate does get repurposed and evolves, and I think we may see that again. I think if there is some degree of decongestion away from urban centers, which is the areas where a lot of these sensitive populations, racially diverse populations that got disproportionately affected, that may be an opportunity for us to correct some of these inequities. Now, switching to the first topic that you started about, what can we do as society? Universities have a role to play. Universities are institutions of privilege and access, and especially universities like Frank's and mine, and we offer transformational opportunity to the people that come through our doors. So we need to be able to do more of that, and we need to be able to nurture what happens while people are in the institution, and perhaps what happens after they leave the institution. So that's one thing that we should be doing more. I think I want to add to the list of structural problems that Frank was identifying before, one that I think is at the core of what is happening, and that's the educational system from K to 12. I believe that that's a structural issue. It's a big issue in this country. And without addressing that issue, it will be difficult for us to provide pathways to sort of healthy, prosperous, inclusive, participating trajectories for all. I think that's a crucial piece because you get people off in the wrong path when they're like under 10 years old. So I think that is something that we should fundamentally hope and work to address in this country. And I think even the issue that I was mentioning with the universities have a role to play, but we actually need to work even earlier on in what happens before, when people are young. And one would hope that this call to action that has come to us right now is going to be a truly sustained effort, an effort that we're going to all make our own personal decade-long commitments. And if we do that for a long period of time, sustained period of time, I think we can actually affect positive change. But there needs to be political will. This is not a problem that individuals can solve by themselves. I'm talking to business leaders now as my job as a dean, and they're working and thinking about that problem crucially, and businesses can help solve societal problems, as you know very well from your job. But I think governments should also play a role there. I'll stop at that.
Costis, Catherine, and Frank, I can't tell you how much I've enjoyed this conversation. Hopefully the folks who are tuning in have also found it as illustrative and as thought-provoking as I have. I thank you guys for making time. I know these are busy times for each of you. And I, on behalf of the Foreign Policy Association, our sincere thanks for you participating. Not only the passion that you showed, but the candor of your remarks are truly appreciated. And I think will hopefully be provocative in terms of having people viewing this think about what they can do as we try to figure out how to move forward socially and economically at this moment in time in the wake of COVID. So with that, thank you very much. I look forward to continuing this conversation informally with you whenever we can get together, either virtually for a drink or in person.
Great.
Wonderful.
Thank you so much.
Thank you.